What does it take to disrupt our healthcare systems? As clinicians, we know the field inside out and have the power to lead change on a massive scale. Whether you're interested in the business or the social sides of medicine, how can you implement your vision for social and entrepreneurial change? Today, we're sitting down with Dr. Griffin Myers, an emergency doc by training and also successful physician entrepreneur. Dr. Myers is the founder and CMO of Oak Street Health, a series of clinics that use a value-based healthcare model. With his leadership, Oak Street Health has expanded to 15 clinics in the Midwest. Be sure to subscribe to Doc Thoughts for more awesome interviews. All right, let's hear Dr. Myers. Thanks for joining us in Doc Thoughts, Dr. Myers.
Yeah, my pleasure. Thanks for having me.
In what ways does medical school prepare students to become successful social entrepreneurs?
Yeah, you gave me that ahead of time to think about.
Yeah.
And, the most important thing is just to be a good doctor.
Mm-hmm.
The other things will come if you want them to come. But realistically, if you haven't learned your craft and you haven't learned to listen to patients and to build relationships with patients and to understand what they're up against and to understand their problem, because ultimately, if you're trying to be a physician entrepreneur, a physician executive, two things. Number one, that always starts with physician. And the second thing is you've got to know what their problems are so you know what solution to provide. So for me, some of the best advice I ever got when I was a resident was don't think about that other stuff. Just learn to be a good doctor, be able to run a good code and run a good trauma and have all the nurses like you because you're easy to work with, and listen to patients and treat them like you treat your family. And if you can do those things, that translates really well into any other leadership venue that you want, because then you've got the respect of your patients and you have the context and you've got the respect of your colleagues. I would always say, Start by being a really good doctor.
Do you believe that your background in medicine gave you an advantage in the business world?
Yeah, absolutely. I should tell you, though, I don't consider myself a business person.
Okay.
I'm a doctor.
Yeah.
And I say that very seriously because I'm not greedy enough. I mean, I'll tell you, I think to be a good business executive, you're a fiduciary. You've got to use the assets that you have to create the most amount of wealth or return for the people that own those. And there are really important roles that sort of person plays in society. For me, I would be perfectly happy making far less money but delivering far better care. The question you asked, however, was did your training as a physician make you a better executive? The answer to that is unquestionably. I mentioned this before. As a physician, you look around the room often and you say, who's the adult in the room? And that's you.
That's you, yeah.
And you're the one who has to make that decision in that moment. How do I want to manage this airway? Do I want to open this person's chest? Does this person need a procedure? And you don't have the luxury in those cases to get emotional. And you've got to share a lot of information and take in a lot of information. And those are the skills to me that when I say that now, I used to think about that in the context of being in the hospital. And now I think about that in the context of either being in one of our clinics or being in our corporate office or in a boardroom, and the stakes aren't as high. Mm-hmm. It's far more important to get those decisions with patients right, and so when you know that context helps a lot. But unquestionably, it helps you, and it's about having a structured way to think about problems. It's about being a good listener, and it's about not getting emotional in situations where I think people typically do get emotional.
What advice would you give a student or a physician who is looking to actualize their goals for social change?
I hope people went into medicine for the right reason, because you just don't know what it's going to look like in the first 10 years of your career, the second 10, the third 10, and then the fourth 10, And so if you make decisions based upon the car you can drive, the house you can live in, you're making the wrong decision. I hope that what people go into medicine for is for service. It doesn't mean people have to go hungry, and we don't need to make martyrs of people, but those are the things that I would look to when it comes to motivation. And then when you talk about if somebody's got something that they want to go after, that's non-traditional in medicine, and I think that's what you're suggesting, whether it's entrepreneurship or something artistic or something in the social justice realm, it's going to be different. And as physicians, particularly as medical students, we look at people's achievements as their degrees. And once they have the degree, look at where they went to school or what specialty they're in. And you are going to have to really quickly, as a person, get rid of that concept that your value to the medical establishment or to your patients or to society is related to the degrees that you have in the institutions you got them from, because I don't have a degree for starting a practice, and I get a lot of critics. My practice has grown a lot. You could just as easily start a smaller practice that takes great care of people, and it's an impact that you wouldn't necessarily be rewarded for in money or in prestige, and it's still an incredibly worthwhile thing. And so I often encourage students when I talk with them not to think traditionally about the things that have been valued to your advisors and to your parents and your professors and even to colleagues, but to think outside of that. What are the things that you want to accomplish? And if you can separate those from the money and the prestige, you're left with something that's pretty cool. And one of the things that was hardest for me was, like I said, I loved a lot of medicine, and I took 3 years off before going back to be a resident. And everybody told me it was a horrible idea, my family included. 3 years later, after doing that experience, when I told them I was going to leave that world and go back to medicine, they told me I was crazy. And that I was wrong to do that. And so you're going to hear that a lot, and you just have to be prepared. If it's something that's important to you and you know you can be successful, you got to do it.